All opinions and expressed views in this video are those of the person expressing them, and not of the entities, persons, or corporations.
Well, here it is. The video I've been wanting to make. It's been longer than I expected to come out with this one. And this one is over the Pettis County, Missouri COVID numbers. Along with life, the added pressure of the COVID social changes has caused some extra issues to crop up. Yet I finally finished the video, so here it is. To keep this in hope moderately interesting, I am giving a quick overview of the frequency the local health department is providing the numbers to us. Next, I'll be presenting the data questions drawn from what I've seen going over the data. Thirdly, are the numbers and data itself. Following this will be some current conclusions because it is just keeps it's a running tally, an accumulation of the numbers, and then my hopefully maybe recommended solution or suggestion to maybe hopefully clarifying some of this and maybe having some decrease in some of the arguments I keep seeing online, and a few concluding remarks. And so with that, we'll go from there. The frequency of the numbers given to us by the Pettis County Health Department vary between 5 days a week down to 1 to 3 days. And this is looking over the past about the past 4 months, 4 or 5 months. The pattern appears to be that no numbers are given from Saturday to Monday. This is understandable between how frequently they gather the data from their source. With this in mind, we're going to look closer at the numbers as shown to us by the Pettis County Health Department. While gathering information for this video, I look for any information on their website, such as the source of their numbers, or information on how they are presenting and using the data they give us. I was not able to find any. It is a safe bet to say they receive their information from the hospitals and lab in the area. Another source for anyone to go to is the Missouri COVID-19 mobile dashboard. Here we see several different tabs. Numbers according to the county, the demographics, the two testing types, PCR and serology, deaths and hospitalizations. Some of the questions that have come to my mind while looking over this information are, what does active mean in comparison to confirmed cases? Why are we not seeing the persons under observation as often? Where are they observed from? From tests administered, what are the numbers between confirmed cases and the non-confirmed? Over the past month, looking closer at this has given rise to a set of questions for me. Regardless if these questions find answers or how relevant they might appear to be or not to be, it is important to know we can ask them. And the first is, how are confirmed cases defined? Second, how are active cases defined? What necessitates release to normal activities, and how is it defined as well? How are the confirmed cases counted? How often are the release to normal activities cases decreased from confirmed cases? And how is this decrease shown in the confirmed cases? Next, how are the non-active cases shown in the data sets? And how are they presented in the Pettis County daily numbers and the Pettis County testing data? Next, what are the percentages of the non-active cases in comparison with the active cases? How are the non-confirmed cases accounted for in the tests administered? If not, why are they not accounted? After being released from the hospital, are the hospitalized cases placed into released to normal activities or kept in the active or confirmed cases? How are the persons under observations defined? As a matter of fact, how are they observed? Next, how often are the confirmed cases decreased in relation to the release to normal activities and deaths? Lastly, are those who died recently hospitalized, and what were their underlying conditions? In my question set, I've introduced two new terms, non-active and non-confirmed. I have done this based off the information we are given. When looking at data, it is best to look at everything we can from different points of view. For example, in the data of the health department gives us, for example, we have something called confirmed cases. What about those who've been tested and found not confirmed with the test results? So to clarify these new terms, here they are. Non-active, of course, is opposite of active. This is in relation to the Pettis County Health Department active cases. Since the active cases are coming from confirmed cases, it might be that the active cases are a higher rate or severity of infection or symptoms. Sadly, the health department is not giving enough information on these numbers they are providing to the public. The next one is non-confirmed. We see confirmed cases and can safely conclude that these are the individuals who have been tested and found positive. Non-confirmed, then, are negative test results. Although I found no information on the clarity of their data sets, we can at least try to draw some conclusion from what they are presenting to us. We all do this whether we admit it or not. We look at the categories such as tests administered and conclude that this has to do with the number of administered tests for the COVID. And when we look at confirmed, we see that they will be positive results because that is what they are tested for. Although the Pettis County daily numbers and Pettis County testing data numbers are cumulative, we can at least still draw some information and data from them. As of September 4th, 2020, only 13.77% or 110 of confirmed cases are currently active cases. Up to 85.11% of confirmed cases are now released to normal activities. After release to normal activities, 119 cases are still considered confirmed. 799 out of 8,606 are considered non-confirmed or negative results. Thus, 90.72% are not infected with COVID-19. Currently, 799 are confirmed cases. Thus, only 9.28% are considered positive or confirmed cases. And as of today, September 8th, there is about 9 individuals who reportedly died from COVID-19. Now, one thing I want to make clear is that even though there are testing, and the more people we test, the more likely we find, whatever it is we are testing for. So the more likely we have confirmed tests or positive tests. Well, that's pretty much common sense. Not going to lie. And that's one of the things that people will point fingers at others and say, well, then just stop testing, then you'll stop finding positives. Well, yes, but on the same coin, on the other side, the more people we test, the more likely we'll find positives. Or maybe not. Maybe those positives just might level off somewhere, or there will be a decrease in positives. It all depends upon factors such as the test validity and how well it is, and whether or not they're false positives. And that goes for anything, really. Um, but here we are going to go ahead and look at the months we have overall, May through September. So here we find the confirmed, active, and released cases by the end of the month. As we do see here, interestingly enough, we do see, of course, the total confirmed cases going up. But the increments do start becoming smaller. We see May at 78, June 122, July 378, August 763, and September 837. Now we see the active cases. 10 for May, 28 for June, July 112, August 108 active cases. And for September, 119. We see it pretty much leveling off right there from July to August to September. Now, what we also have on our graph here is the total release to normal activities. So we have 68 for May, 93 for June, and it jumps up to 262 for July. For August, 646, and then for September, 708. Now, what we are having, at least what I'm seeing here, is that the confirmed cases keep going up, but there is no relation to normal activities. Well, we can confirm with confirmed cases that these are positive cases, as we said earlier. So then we are seeing the total release normal activities. Why then are we not seeing a decrease in confirmed cases? This is something that I think, at least personally, is a little bit of an issue. Because we are seeing, while these total release normal activities are no longer negative, or whatever the case may entail, I've heard from certain people around that if they are positive, then they do not have to be tested again. All they have to do is wait for the symptoms to decrease. But they will not be tested again whether or not to find out if they are negative, because chances are they'll still be positive. So this is an issue here, and maybe we get to that later. But the the approach that we are having to this virus and what it means, and whether or not the science is exactly valid, practical, theoretical, that's a bit of a problem. It really is. And that's one of the reasons why I question the use of release to normal activities. So, moving on here, we can find our confirmed cases from tests administered. The percentage rate, of course, continues to go up, which is not surprising. Our active rate from the confirmed cases, we see from May to June continue to climb, and then from July at 29.63%, it drops down to August 14.15, and it's pretty leveled off for September for now. Release to normal activities is pretty much relatively high. There's really not much difference there. Which really does again make me question what exactly is the purpose behind all this testing. Well, for September here, we are looking at the September totals. We are looking at tests administered after confirmed cases is 7,900. Confirmed cases after active cases, 718. And confirmed cases after release normal activities is 109. For our September percentages, we do find that confirmed cases from tests administered is 9.58. And this is low, especially if we're comparing it to released normal activities from confirmed cases. 84.59%. And our active rate from confirmed cases is, of course, 14.22%. So this is a numbers game that we're seeing here. This is what's going on. And this is where I was bringing up the question of what does it mean to be released to normal activities? So here we briefly see a September weekly comparison. Our total active, represented by the blue, and the total release normal activities by the orange. And of course, we're seeing a 4 difference between the two on September 2nd. And we continue to see the differences between those. Again, this is a big numbers game. Death numbers and percentage from tests administered, we have a 0.11% since we are looking at deaths from those tested. And so far, there's only reported that 10 out of 8,737 have died. Of course, more people have probably been tested, yet there are still 10. So there are 8,727 people still alive from the test administered group. And for little extra information, if we take the percentage from confirmed cases, it is 1.19%. This continues, of course, with the deaths. Sadly, again, this is a numbers game. It has become a numbers game. It is the definitions and the approaches that need to be looked closer at. And sadly, this numbers games, it cheapens the lives lost and even the jobs that have been run under with this COVID thing. It cheapens all this. And sadly, it has even cost the families as well. So with everything we've looked at, we're going to look at our current conclusion. Out of 8,606 tests administered, currently, as of September 4th, there are 799 confirmed cases, while 119 of confirmed cases are active. Yet out of the 799 confirmed cases, 680 are released to normal activities, leaving us with 119 still showing as positive cases or confirmed cases. Thus, more individuals are being released to normal activities as compared to confirmed cases and active cases. This is showing a high rate of recovery. The issue is that these numbers are not being given accurately to the public in two ways. First off is as a cumulative and not showing any changes according to the release number. The accumulative effect continues to be shown and enforced through, in my opinion, not only mask wearing, yet the lack of discrepancies in data gathering, inaccurate reporting of numbers, and quite possibly the false positives. My suggestion is more information to the public. The Pettis County Health Department, I suggest, should place a document for all to see containing references for their numbers, how they break down the numbers from the tests administered, clear definitions to what they mean by active, released to normal activities, confirmed cases, what they mean by persons under observation, and their approach to those observations, and showing confirmed case numbers relative to the release to normal activities. Also, the non-active and non-confirmed cases. This video is not about nitpicking any numbers or the health department. As with any of the other videos I put out, I want to promote seeking information, asking questions, critical thinking, and finding answers. Hopefully, if possible, by the health department providing this type of information will help to decrease some of the arguments and help to shed light on what is going on rather than not saying anything at all. And not saying anything at all can possibly uphold the stereotypes and labeling I keep observing online, and sadly it happens on the news and in our day-to-day lives. After all, what we continue to allow to influence us has an impact upon the life we allow ourselves to live. Sadly, there is enough to put up with way before COVID came around. Cultural warfare such as racism or the perception of it or of the perception of anything in our lives. Enforcement of social stereotypes, mental illness, political divides, breakdown in social and family structures. The list goes on and on and on. If the ones we are to trust with their health and information cannot at least provide accurate and decent information, the ones we should at least trust to make decent and viable decisions for our lives is ourselves, and at best come together as a people who have time and time again tossed aside the baseless arguments of policies, professionals, and politicians have thrown at us time and time again, and work together as a true people away from the fears and self-interests, and decide who is telling us to hate or divide us against others because they are different, or they appear to be a threat to us, and say, no, I choose not to believe things about others they have not shown. I've come to believe that if what we are told and what we see are two different things, then we have the right to question those who speak to us, especially if what we are told leads us to division or hatred based off what we ourselves do not wish to be judged from. I do have the graphs and data in the description for download. This is Daniel with the Jeremiah Letter.